name is Jim Doyle, and I'm president of Business Forward. I'm pleased to moderate this briefing on affordable healthcare and a strong, caring economy. We have some great panelists. They are Jim Skogsberg, the president and CEO of Aurora Advocate Health, Mary Kay Henry, the president of Service Employees International Union, Congresswoman Susan DelBene, who represents Washington's 1st Congressional District and serves as vice chair of the new Democratic Coalition, and Julie Chavez Rodriguez, a senior advisor for the Biden-Harris campaign, and before that, a top advisor to Senator Harris. Jim, Mary Kay, and Susan will each talk about their respective organizations, what they're doing to deliver or protect affordable health care, and how they're adapting to the challenge of COVID-19. In doing so, they'll be presenting 3 critical perspectives: hospitals, healthcare workers, and Congress. Julie will speak last. She'll outline the Biden-Harris healthcare agenda, but she's also here to answer your questions and listen to what the leaders with us are recommending. Vice President Biden and Senator Harris have made clear this is a challenge Washington can't fix on its own. They'll be relying on and supporting leaders like Jim, Mary Kay, Susan, Joe, and you. To start us, we'll hear from a delegate from California, Joe Kiani. Joe is the founder of Masimo, one of the world's most respected medical technology companies. He's also a leading expert in patient safety, and he's helping lead Vice President Biden's cancer initiative, Project Moonshot. Before we get started, a few notes on logistics. First, you can participate by emailing your questions to us at info@businessfwd.org, and I'll read it out loud during Q&A. Please include your city and the name of your business in your message. Again, that's info@businessfwd.org. Please note this call is on the record and there may be reporters present. Finally, I'd like to thank our host committee sponsors, Aurora Advocate Health, the Service Employees International Union, and Joe Kiani for making today's panel possible. Joe, please kick us off.
Thank you so much, Jim. Well, first of all, I just want to say it's such a great honor and joy to be here with you today at this historic convention where a man with incredible empathy, experience, and expertise is running for president. And it's also a man that I consider a close friend. All of us at Masimo, Circle Corps, A Starting Point, and the Patient Safety Movement Foundation are grateful and humbled by the dedication and sacrifice of our colleagues who are at the front lines of caring for patients around the clock, even when their own lives are at risk. I've spent over 30 years of my life doing everything I can to help patients and improve lives. In 1989, I started Masimo in my garage, and we're very proud that our breakthrough technology is now used on more than 200 million patients a year in leading hospitals and other settings around the world. And it's the primary pulse oximetry at 9 of the top 10 hospitals in the United States. With the help of our solutions, premature infants are having their eyesight protected, congenital heart disease is being detected, overdoses from opioids are being prevented, and COVID-19 patients are being continuously monitored from the comfort of their homes, freeing up much needed ICU beds and saving limited PPE supplies for our nurses and doctors. Where my colleagues and I have moved at best grains of sand, the Affordable Care Act has moved mountains. With the ACA, not only have millions of people received access to primary care and medicines that prevent emergencies and ER visits, but the ACA has also emphasized quality, safety, and the dignity of patients and care providers. While working on solving unsolvable issues in healthcare, I started the Patient Safety Movement Foundation. In the United States, it is alarming that medical errors are the 3rd leading cause of death, behind heart disease and cancer. The Patient Safety Movement Foundation has created nearly 30 actionable patient safety solutions that can help dramatically reduce deaths due to medical errors. We have worked hard to secure commitments from hospitals to implement these actionable patient safety solutions to prevent these medical errors from becoming fatal. To date, close to 5,000 hospitals in 48 countries have made commitments that last year resulted in 93,275 plus 1 lives saved last year. When we talk about patient safety, we need to recognize the significant impact that the Affordable Care Act has had in making healthcare safer over the past decade. The payment incentives and quality improvements that were established by the ACA are saving lives and reducing medical errors. Without it, the patient safety movement's efforts may have led to very little. There's still much more work to be done, but we are heading in the right direction thanks to the ACA. We need to not only keep the ACA so that people can continue to have access to primary care and medicine, but also enhance its safety measures by aligning incentives, improving transparency, so that we can get to zero preventable deaths in our hospitals. Thank you for the opportunity to be part of this historical Democratic National Convention. I applaud your steadfast commitment to improving healthcare for all Americans. I'll now turn it back to your esteemed panel today. Thank you.
Thank you very much, Joe. We really appreciate it. We'll start with the panel. We're going to have each of the panelists introduce themselves and talk a little bit about what they're doing. Congressman Del Bene, why don't you please start us off?
Great, thank you, Jim. And it is truly an honor to be here with all of you talking about probably the most important subject we could be talking about. I'm Susan Del Bene. I represent Washington State's 1st Congressional District, and I serve on the House Ways and Means Committee, where we are working on a lot of policy related to healthcare. This has been an incredibly challenging year for so many. We had the first cases identified of COVID-19 in my district out here in Washington State, and it has been an incredible impact on our community and highlights really the incredible need we have for healthcare for every single person in our country, and the dependence that we all have on each other, how important support for public health is, how important it is that we support a workforce so that we have people who are able to provide that critical care, the incredible essential workers who are serving our communities. But it's also highlighted how important it is that every single person in our country have access to affordable quality healthcare. Really, the goal of the Affordable Care Act, the incredible breakthroughs that it put in place, how important it is that we not only defend those, but continue to build on that and expand. And COVID-19 and this pandemic has really shown how important it is that we have strong federal response when it comes to healthcare, making sure that we have the supplies necessary for testing, the personal protective equipment that impacts our resource. And so a strong federal response is so important, a place where we have been woefully lacking so far. It's also showed how important it is that we are resilient and prepared for the future, looking at what's coming, make sure that we have a federal response in terms of pandemic planning, and making sure that everyone in our country has resources they need to be prepared. This has also really highlighted inequities that already existed in our healthcare system. Glaring inequities and systemic racism have been at play even in healthcare. We know that people of color in our communities have been impacted more greatly by the COVID pandemic, but also prior to this in terms of impact from underlying illnesses. We have to make sure that when we look at our healthcare response and our healthcare system, that we address those inequities, whether it is in terms of healthcare research and the data that we collect, as well as making sure that we have a system that provides affordable quality coverage for everyone in our country. The pandemic has also shown us how dangerous it is to see the ACA dismantled piece by piece. We really need to move forward and continue to protect it and enhance it. That's why it was so important that we passed the Patient Protection and Affordable Care Enhancement Act in the House this year, so we can continue to build on the Affordable Care Act and make sure that healthcare is available for everyone in our country. We will not be able to handle a public health crisis unless we continue to make these enhancements to our system. So while we must also address the healthcare disparities for people of color, especially women in our country, we need to continue to protect women's reproductive rights and access to reproductive health care. We need to address the high cost of prescription drugs that have impacted communities all across the country. Another place where we have stepped up in the House and passed the Elijah E. Cummings Lower Drug Costs Now Act. Again, this is critically important that we continue to build on the efforts that we're making to address this critical need for our communities. We need to reform our delivery systems and also look at new innovations that are available on telehealth and how critically important that has been, not only in the pandemic, but how important that will be going forward. There's no one size bill that addresses all of these problems. That's why it's so important that we work together, that we talk to the people in our communities to know what we can do together going forward to continue to see what's working, address what's not working, and move our country forward. I look forward to continuing to work together with the Biden administration to have a real and a positive impact on the inequities in our healthcare system long after the pandemic abates. So I look forward to your questions, and thank you so much for letting me join you today.
Thank you so much. Jim?
Yeah, thank you, Jim, and good afternoon, everybody. As was said at the outset, Advocate Aurora Health is pleased to be a sponsor for the Democratic National Convention. Frankly, we were looking forward to showcasing our great state of Wisconsin and the beautiful city of Milwaukee, but alas, that is not to be. Nonetheless, I do want to say that it's a pleasure to join Congresswoman Delbene, Mary Kay, and Julie to discuss making healthcare more affordable and accessible, and particularly now during this challenging time for our nation, a little bit more about my organization. It's an N of one, but it gives you some context for the conversation that we're going to have. We are a two-state system, Illinois and Wisconsin. We serve nearly 3 million patients annually, including about 700,000 Medicare beneficiaries and almost 500,000 individuals with Medicaid coverage. We're a not-for-profit healthcare system. Leading employer in the Midwest, we employ about 70,000 team members. That's 22,000 nurses, 8,000 physicians, many of whom are serving on the front lines during this pandemic. And over the last 4 months, we have provided significant support to our workforce. While we have furloughed individuals, it's been with full pay and full benefits. We provided special COVID pay for our team members. We have provided special benefits for their paid time off. We've given additional support for lodging and for housing and for daycare. We've maintained our 401k match during this whole process. And we've done everything we can, actually provided a merit increase last month for our team members. We're committed to be an employer of choice, and pleased to talk about that, given part of the program is very focused on, a caring economy and caring employers. But I think if we're going to have meaningful discussion on healthcare affordability, we're really also going to have to address access, equity, quality, and innovation. With respect to affordability in general, we're all concerned about the rising cost of healthcare and our ability to afford the healthcare that we need. Advocate Aurora is on the front lines of efforts to lower costs and to improve safety and quality. One example, we're founding members of Civica RX, which is a not-for-profit generic drug company established by a large group of integrated healthcare systems to bring down the cost of medications and to supply our patients with generic drugs at affordable prices. And as one of the nation's largest and most successful Medicare accountable care organizations, ACOs, we have a unique partnership with the federal government and taxpayers to accelerate the transition from a fee-based system to a value-based system. Since the program's inception, we have saved taxpayers over $200 million through the Medicare Shared Savings Program while providing high-quality care to our patients. With respect to access, the good news, as I'm sure we'll get into, about 90% of U.S. residents have health insurance today, with significant gains in coverage occurring over the past 5 years thanks to the ACA. That's the good news, because coverage unlocks doors to care and generates better outcomes and productivity. The bad news, of course, is that approximately 28 million individuals remain uninsured, and many more are underinsured. We need to preserve the gains in health coverage since the passage of the ACA and further expand coverage by ensuring the stability and affordability of the health insurance marketplaces and encouraging states to extend coverage and care to their population through the expansion of Medicaid and private insurance. With respect to equity, COVID-19 has exposed, as was commented by the Congresswoman, disparities in our most vulnerable communities. African American, Latinx, Native Americans in particular. We need to address the social determinants of health and ensure that every person in every community receives high quality care. To that end, Advocate Aurora Health is a founding member of the Health Anchor Network, one of 15 health systems that have pledged to invest over $50 million to help address economic, racial, and environmental disparities that impact community health outcomes in our states, Illinois and Wisconsin. We've intensified our efforts because the health and healthcare disparities that continue to exist for far too many racially, ethnically, and culturally diverse individuals. They really have to be eliminated. Finally, regarding quality, hospitals and health systems have made great strides to improve quality of care, quality measurement, quality improvement, and the adoption of hospital field standards and best practices to continuously improve patient care. Public policies around quality, especially the Centers for Medicare and Medicaid Services, CMS, quality reporting and pay for performance programs, Medicare and Medicaid conditions are critically important. We absolutely support improving quality, critical to shaping and accelerating the field's efforts to make care better and safer. Finally, innovation is happening rapidly before our eyes. Telehealth and other technologies have enabled us to continue taking care of our patients during COVID, with over 613,000 virtual visits among our 4,300 providers. We thought we'd do 25,000 virtual visits in 2020. We've already done 613,000. As I said before, when we were together privately, I think that's a genie that we will not put back in the bottle. By increasing access to physicians and specialists, telehealth helps ensure that patients receive the right care at the right place, the right time, through video conferencing, remote monitoring, electronic results, and wireless communications. We can fully harness the huge potential that telemedicine holds by making recent changes to telehealth policies advanced by Congress and the Centers for Medicare and Medicaid permanent. Again, thank you. It's nice to be with you. I look forward to our conversation.
Thank you very much, Jim. And on behalf of all of our colleagues and friends at the Milwaukee Convention, they all are so grateful for the care you've been providing them and the testing. It's been remarkable, and it's a smaller crowd than we wanted, but you guys are taking great care of them.
Thank you. It's our pleasure.
Mary Kay.
Thank you so much, Jim. I'm so grateful that Business Forward organized this critically important discussion around healthcare and the economy in this amazing time. And I'm so grateful for the Congresswoman's advocacy with working people in her district and in the House. And Jim, I'm so proud of the work that Aurora has done. I was thinking as you were talking, imagine if what you provided to every care provider in the Aurora system was the standard for the 10 million healthcare workers across this country. And that's what I think is so exciting about this panel, that we are about solutions and how to work with national leadership that can actually create the conditions that allow everyone in this country, no matter what zip code, what our race, what our gender, can thrive. And I just wanted to say that on behalf of the 2 million working people that I represent and the millions more fighting for 15 and a union, that working people and our families and communities understand that the triple crises that the Congresswoman outlined on public health, on the economy, and on race require that this be a moment of reckoning for our nation. And working people like Lenora Malin and Julie Moore, who we'll hear questions from later in this panel. Julie works in a nursing home and Lenora as a home care provider. And even though they're in two different care settings in the long-term care system, they're having to fight against a system that has never really thought about how to care for elders and people with disabilities in a seamless way, from nursing home settings to home and community-based settings. And that this is a system that has never paid these jobs enough money. It doesn't train them for the grueling physical work that they do every day. And the pay between $7.25 an hour and minimum wage to maybe $11 in the non-union settings. In the union settings, we've been moving this work to $50 an hour. The pay says that these jobs are less important. And their questions about this moment of reckoning speak to what I look forward that we will be engaging on as a panel. And one thing that we hear from across all the questions is that we are at an inflection point, that this can't be just another moment that passes. And that's why working people have been taking to the streets, have been holding car caravans, showing up on social media to demand real structural change. Too many healthcare providers have died. Too many have been infected and taken the infection home to their family, who've been on the front lines of this crisis. And the conditions have led to this weren't created by the coronavirus. And the coronavirus revealed what we already knew was there. And now it is impossible to turn away. That's why SEIU members have been fighting to rewrite the rules so that every working person can have a voice through their union and a seat at the table, much like this, where business, the healthcare community, government officials come together to solve the scale of the problems that all of our communities face. And healthcare workers want this opportunity. Since the beginning of the pandemic, our locals have seen an explosion in the number of nursing home workers in particular who want to join together and form a union. And we know it shouldn't be so hard, but caregivers are fighting against 400 years of anti-Black racism and decades of attack on working people. Care work in particular has never been treated with the same respect as other professions. It was dismissed as women's work. It was marginalized because we enslaved Africans to do it in the founding of our nation. And caregivers have been sacrificed in a racist compromise because they were and predominantly Black and brown women and immigrants. But for the first time in history, we have nominees for president and vice president who see these women and their worth. And we couldn't be more excited and thrilled that Joe Biden's caregiving plan makes history by prioritizing America's caregivers, predominantly Black and brown women, for the value they provide in our families' daily lives and in making our economy run by allowing all other kind of work to happen. Joe Biden recognizes that if we're really going to address these problems, working people have to have a seat at the table with corporations and government workers. And that's why electing national leadership is so critical. Thank you so much, Jim, for including working people in this panel.
We're so happy to have you with us and look forward to talking more about it. And that leaves Julie to talk about the Biden campaign, the Biden-Harris, there we go, agenda for healthcare and for a caring economy.
Well, thank you so much, Jim, and thank you all so much for having me on this panel. It's a very exciting time for our campaign. As Jim just mentioned, we recently announced our vice presidential nominee, Kamala Harris, and we couldn't be more excited about the overwhelming support and real unity that has come together. I think the kind of energy and excitement and again, unity that we've seen from last week's announcement was sort of the perfect, sort of segue that we needed going into convention this week. And we're excited to continue that effort with a historic convention. While it won't be necessarily confetti drops and balloon drops, as we've all traditionally experienced, the kind of excitement and the opportunity to engage is much broader than it's ever been before. And so we can't wait till the end of the week to be able to report out the numbers of people who watched, who volunteered, who donated, because it's really been tremendous. And we know that you all are a part of that network. So thank you. So to get into the kind of guts of the policy, I think let's first talk about the immediate, and all the speakers have talked about just the challenge that our country finds itself in, from the public health crisis to the economic crisis to the continuing concerns around racial inequality in our country, coupled with or exacerbated by just a real lack of leadership from the current administration. So the first thing that Joe would do is to focus on the immediate crisis at hand and ensure that there was adequate access to PPE, to testing, to treatment, to vaccinations once they become available, especially for workers who are called back to work or who are having to respond and address the front lines of this crisis. So that's the most immediate thing. In terms of his healthcare agenda and the Biden-Harris agenda, it really focuses on kind of 5 key pillars and covering a lot of what the former panelists really spoke about. The first thing would be to lower the Medicare age to 60, to help to ensure that more folks, and it's roughly about 20 million more Americans would be eligible for the health insurance program by lowering the age. And he believes that it would also help to support driving down costs by bringing sort of healthier folks into the Medicare system and not within the private healthcare industry. The second piece would be, backing a new Medicare-like public option. I think it's an important aspect of the Affordable Care Act that we know was a critical component that wasn't realized. And so to be able to provide this as an alternative for individuals whose whose states have not expanded Medicaid or who otherwise are not, don't feel like their employer-covered health insurance is adequate, or just who don't have access to health insurance, especially as we know our gig economy and other informal employment sectors continue to grow within our country. The third area is boosting the Affordable Care Act and helping to increase subsidies so that it is covering more of the costs for more Americans and ensuring that no American would have to pay more than 8.5% of their annual income towards premiums, which is really significant. I think we've all unfortunately been subject to surprise billing and all of a sudden getting a bill for services that we figured were routine or covered by our insurance. And so to really be able to stop surprise billing and to really, rein in some of what we know are the critical challenges in terms of the high costs of healthcare. And the last piece is, prescription drug reform and looking at ways to ensure that we are at par with other countries in terms of, the cost of drugs here in the U.S., because we know that other comparable countries sometimes are paying lower for the same pharmaceuticals that we're paying here in the U.S. And also to create opportunities to ensure that drug companies are negotiating with Medicare, given the heft of the program and their ability to be able to negotiate down prices. So those are some of the key components of healthcare. But I know what many of us are really excited about, not that healthcare isn't exciting, but it is really looking at this sort of new opportunity to begin to address the caregiving economy that Mary Kay Henry spoke of. Joe throughout his life has experienced caring for elder parents, has experienced caring for folks with chronic illness. And I think many of us have heard him speak so passionately about his time with Bo. And he knows, firsthand that even before COVID hit, there was a caregiving crisis in our country, that we did not have the kind of support for the workforce or the ability for those individuals that were doing the care to be able to be paid or to be able to have tax incentives to work within this industry. And as Mary Kay mentioned, it is predominantly women of color, and oftentimes immigrant women who are either going uncompensated for the care that they're providing or not being fully valued for the care that they're providing. And COVID has only exposed and exacerbated a number of those issues in terms of what our country really needs. So Joe Biden has also incorporated the caregiving economy as part of a main pillar of his jobs agenda. And I think that that's important to note, because oftentimes when we see a jobs agenda, we do see agendas coming forward that look at the critical issues like infrastructure and manufacturing. But now we have the opportunity to be able to expand that into a whole new area to really look at, again, some of the most critical needs of our family. So expanding access to a broad array of long-term services and supports for our elderly, treating caregivers and early childhood educators with respect and dignity and giving them the pay and benefits they deserve and opportunities to unionize, expanding early childhood care and ensuring that no one has to spend more than 7% of their income on childcare, and building more infrastructure around childcare facilities that are energy efficient and developmentally appropriate. So those are just some of the key components of the work that we're doing and what our agenda is in this area. Thank you, Jim.
Thank you very much, Julie. So if you'd like to ask a question, please just email it to us at info@businessfwd.org. If you can, include your name and the city you're from and the name of your business, and we'll be sure to get to it if we can. We've got a number of questions about caregivers, including a couple of the members that you mentioned before. So what I'd like to do is just combine a couple of them, if that's okay with you. The first is Julie Moore, a nursing home worker from Pennsylvania. She's concerned about how vulnerable her residents are, how she and her coworkers have been fighting for a long time, and thinks that this is the moment to speak out together. She asks, how can we ensure that nursing home workers also receive the wages, benefits, and training needed to safely care for seniors and people with disabilities in our nation's nursing homes? Michelle Beckley from Merlot Skincare in El Paso, Texas, asked a similar question. What can we do to give caregivers, child, elderly, other abled, how can we help them be valued as essential workers and see increases in pay? So Mary, what's the mechanism for increasing pay and how do we do it?
Well, my heart goes out to both of the questioners because I think we know as a nation that of the hundreds of thousands of deaths that we've been experiencing and absorbing the shock of, over half have occurred in nursing homes. And so to the questioner in nursing homes, I think what Julie just outlined that the Biden-Harris team is suggesting is the biggest next step, where the federal government agrees to prioritize investment in services for seniors and people with disabilities so that nursing home workers and home care workers get the resources they need for the people they're caring for is one. And two, I think the amazing thing that Vice President Biden has said is he wants to create 3 million care jobs in home and community-based care, child care, and public health, which is a way to tackle the pandemic and get the economy going and valuing work for the first time in history all at once. And so that's the intervention that's being proposed by the candidates. I think our collective intervention is to register to vote, get our absentee ballots, to get ready to make clear in November the change we want to actually invest in this care work and make it easier for nursing home workers and home care providers to join together in unions and bargain with government and employers in an ongoing way that deals with career advancement and the wages and benefits that this work deserves. My imagination is that Biden and Harris are going to do for care work what was done in the 30s for industrial work and create the most multiracial, inclusive middle class this nation has ever seen, because these are the fastest growing jobs in our economy. 2 million home care providers, soon to be 2 million child care providers, on its way to being 3 if we invest as a nation. I think it's an incredibly exciting time to get involved and to organize and to push for this kind of dramatic change.
Just to follow up on that, we've got a question from Lenora Macklin, who takes care of her mother and it requires 24-hour care. She asks, how will the Biden caregiving plan recognize the real work we do as family caregivers to keep our loved ones at home and in our communities? How do those solutions play out for them?
Well, for Lenora, what the Biden plan does is invest in senior care so that you can get more than 3.5 hours of reimbursed care for the 24 hours that you're caring for your mother, and creates equity across family caregiving and caregivers that go into people's homes. And so this is going to create a sea change, Lenore. Actually, Jim had a chance to meet with Lenore, and she's balancing a lot as an essential worker in her home with children who she's also trying to teach at home with the assistance of the remote learning. And so that's why I think it's so important to back Biden and Harris and to keep making clear that these are problems that other nations have solved and we can solve it too.
And Mary Kay, you can correct me if I'm wrong, but I believe it's about 80,000 individuals that are currently right now in the backlog for receiving Medicare services, senior services that our proposal would also help to address. So it's addressing the backlog, it's bringing workers into the workforce. It's, again, making sure that they also have the kind of support and ability to unionize that Mary Kay mentioned. So it's a very holistic approach that we're excited about.
Yes. And what a relief for family members who are concerned about their parent, their grandparent, to have that stress addressed and making sure that we're all in it together in a real way.
And Congressman, what is Congress doing on this?
Well, I was going to add paid leave is also incredibly important. If you're taking care of your family, we think about it with new parents, but lots of times the voices of those who are taking care of other family members who have health issues, we forget about how the incredible work that's happening there. So paid leave policies, looking at things like the expansion of the child and dependent care tax credit to help families with those costs. And again, supporting these incredible workers who are doing such important work for our loved ones.
So we have a number of questions about defending the ACA. And again, I'm just going to try to combine a few of them. Andrew Odzi from Executive Leadership Partners in Waxhaw, North Carolina asks, how will you defend the Affordable Care Act given it is now under assault in the courts? This is an essential program for small business owners with pre-existing conditions. Marcel Jean-Francois from Delray Beach, Florida asks, can we still expect that the ACA will still be available next year now that the Trump administration is trying to get rid of it in the middle of a pandemic? So I'm going to start with you, Congresswoman, just because you're in the middle of the fight, and then maybe we could have Julie and Jim and Mary Kay follow up.
Well, we know how critically important it is, and in Congress we passed the Patient Protection and Affordable Care Enhancement Act to do some of the work that Julie was talking about in terms of making sure that no one is spending more than 8.5% on their health care, to continue to make sure there are incentives for ongoing Medicaid expansion because of the coverage that's provided. We continue to fight to cover pre-existing conditions, essential health benefits, even basic reproductive care like birth control. There have been ongoing attacks from this administration, and I expect they will continue, which is why it's so important that people speak up and speak loudly by being engaged and involved and realizing how critical our leaders are to what happens to healthcare coverage in our country. So we'll continue that fight, but obviously if we are in a position where we can actually pass legislation through the House and the Senate and be signed by a president where we can continue to build on what's working to address the ongoing challenges we have, to actually see legislation like the Patient Protection Affordable Care Enhancement Act to address prescription drug pricing. Those are all things that are important to Americans across the country and have huge support. So the public has been very outspoken about how critical these issues are. We have responded in the House, and we need to make sure that the pieces of legislation like the one I described move forward. So we're going to continue to fight that fight, and this election will obviously have a big impact on what happens in this next Congress and with this next administration.
Julie, anything to add?
Yeah, I would just say, the other piece of this is that, Americans care about healthcare. Now that they have the Affordable Care Act, they are not going to let it be taken away. And so I would just say people have been so amazing and so effective at sharing their stories, whether it's individuals that are fighting on the front lines and helping to deliver and provide care, and our healthcare workers, to those individuals that received healthcare for the first time as a result of ACA or as a result of Medicaid expansion. Those are such critical and powerful stories. And I remember during ACA enrollment, the first open enrollment period, going to an open enrollment in Virginia and meeting an elderly Latina woman who only spoke Spanish, who was trembling because she had Parkinson's, and was able to sit down and get health care that was an affordable premium. And at the end, she was just crying and, kind of sobbing. And she looked at me and the young woman who had organized the enrollment center, and she said, gracias a Dios, in Spanish, translated, thank you, God. And my wonderful colleague, who's a dear friend, said, no, senora, gracias a Obama. Thank you to Obama, because it was the affordable health care that enabled her, an elderly woman with Parkinson's, to get affordable health care.
Hey, Jim, if I can jump in and just share an observation. I think it's safe to say that nobody appreciates how important the ACA is than your nation's hospitals, because we see it in our clinics, in our admitting areas, in our emergency rooms. So that coverage is absolutely essential. In fact, the American Hospital Association, America's Essential Hospitals, the Association of American Medical Colleges, the Federation of American Hospitals, have all come together and filed an amicus brief urging the Supreme Court to reverse the appeals court decision and uphold the ACA in its entirety. We need to preserve the gains in health coverage made over the last decade since the passage of the ACA, and it's absolutely essential for this nation's health. I mentioned in my introductory comments, I think there are currently, 90% of U.S. residents have insurance. That's good. That's the good news. 10% or 28 million do not. And we know that most of them are in, I'm looking at my notes, most of them are in working families with at least one full-time worker, right? Most are below the 400% of the federal poverty level. Black and Hispanic individuals are disproportionately uninsured. And we know the uninsured rate varies by state. As low as 2 to 3% in Massachusetts and as high as 20% in Texas. And then the other thing that is particularly disturbing for all of us that care for kids in the nation, last year was the second year in, it must be 2 decades, where the number of uninsured children actually rose dramatically. So this coverage issue is critical, and the nation's hospitals are all behind preserving and protecting the ACA.
Jim, if you could explain to us, one of the things that we find when we're talking about the ACA is a lot of the focus is on the people who didn't have insurance before and now do, but there are the people who have employer-sponsored insurance also benefit. For example, investing in preventive care reduces long-term costs. Can you walk through, as a hospital, what the benefits are to people who might not realize that they benefit from the ACA because they've got through the work?
Well, so big picture, just the soundbite economic lesson, of course, is those people that are not insured end up as uncompensated care or bad debt for your nation's hospitals. That cost gets passed on. That gets passed on to other employers and insurance companies and so on. So it is so critically important. Part of this is just the law of big numbers, right? So it's so critically important to have everybody insured so that everybody has equal access to the healthcare delivery system. So that'd be my short answer, is to think that we could ignore a certain segment of the population and be okay. It doesn't compute. We need to cover everyone in this nation of ours. And that's why, again, we feel like, man, that last 10%, we can just improve the ACA. Just go do what President Obama was attempting to do and sort of finish the work. We may not have to do those other things. Get some states to, I think there's 12 left that would embrace Medicaid expansion. And you can do that by giving them, full access to the benefits that all the other states had when they first embraced it. So there might be some ways to get a greater pickup for the ACA if we kind of thought about it carefully.
Just for people watching, what Jim was just referring to was Medicaid expansion. And 2 years after the ACA passed, 22 states had chosen not to implement Medicaid expansion. And they were largely run by Republican governors and state legislatures. And just since President Trump took office, Missouri, Arkansas, Utah, Oklahoma, Maine, Idaho, and Virginia all went the other way and expanded in nearly every case, by overruling the Republican state legislatures. We still have about 4.5, we've got about 3 million people who aren't covered, and with COVID layoffs, it could grow to 4.5 million. So that's a big number. I'd like to take a break and talk about some good news, and that's telemedicine. I got a question from Gilson, from Milwaukee, Wisconsin. Will the Biden administration commit to continuing and enhancing telemedicine through and beyond the pandemic? And before we get to Julie, what I'd appreciate, Jim, if you could just explain to us why it's a good thing and how it works and what's happened during the pandemic.
Sure. So, when the pandemic hit, most of your nation's hospitals essentially shut down. As a result, patients couldn't come to see their physician. They couldn't come to the hospital. Those surgeries got postponed or delayed, and we are very anxious about patients across the country seeking the care that they need, because delaying it solves no problems, probably only exacerbates existing problems. So it's very, very important that patients come back and seek care. Now, one of the ways that we and really the entire country in terms of the healthcare providers responded was to embrace, if you will, telemedicine, virtual visits, phone visits, et cetera, as another way of allowing patients to access the healthcare system without coming in. Now, don't get me wrong, true emergencies, patients certainly showed up. But there's a fair amount of care that can be provided via this venue that we're doing right now in conversation, et cetera, and people can sought and receive the care that they needed. Again, not perfect for everything, but I think I mentioned in my comments, and this still kind of baffles all of us. We had thought we had an aggressive goal in 2020 to perform 25,000 virtual visits. And we've already done almost 650,000 virtual visits. So it's better access, right? It gives patients access. It can be lower cost. It can keep people out of the emergency room, which is the lower cost comment. And embracing telemedicine and virtual visits, we think is, for instance, we do not want to go back to the way we've always done it. We think this is a movement that can take us and propel us forward, a new way of providing care in a less costly setting, which is good for everybody. Still great clinical care, which your nation's hospital and physicians and nurses provide. So we're big proponents. We believe that telemedicine is a wave of the future. And again, I said at the outset, I don't think that's a genie that we can put back in the bottle, nor should we try.
Congresswoman, do you have, as you're working on that as well?
I do, absolutely. We passed basically emergency waivers to allow a lot of the expansion of telemedicine. There were a lot of restrictions on things like you could use telemedicine, but it wouldn't be reimbursed if it was from someone's home, which sounds kind of counterintuitive, but you had to go maybe to a center where might be closer than your provider, but still wasn't at your home. So those waivers were important to allow a lot of the work that's happened during the pandemic to happen. I represent one of the biggest technology hubs on the globe, and you can go from one part of my district where we have incredible technology companies, innovation, and drive an hour away and be another part of my district where we don't even have rural broadband or even good cell service. So I also want to highlight, when we talk about disparities that are out there, one of the big disparities also is in broadband access, because telemedicine is a great opportunity, and some of the folks who need it the most in our rural areas where there may not be nearby healthcare workers might still struggle with access due to broadband. So not only do we have to look from a policy perspective in terms of the waivers and making sure that we integrate telemedicine in for things like reimbursement and Medicare, et cetera, we also have to address the issue of rural broadband and access. We see it in our schools and the challenges that students are facing today who don't have access for online learning, but it's a huge issue for telemedicine as well. So incredible opportunities here to really help serve our communities, but work that we have to do not only on the healthcare policy side, but also on the infrastructure side to really, and even in places where broadband access is available, it's not always affordable. So making sure that people have access so that they can take advantage of the opportunities that Jim is talking about.
And Jim, I just wanted to jump in on telemedicine and say that our healthcare members understand that we just leaped forward 10 years, and the percentage of patients that are now going to access their healthcare through telemedicine is what was predicted by, I think, Jim, 2030 just happened in the past 4 months because of the pandemic. And I just think that given that shift, we need to think about the healthcare workforce also catching up with the shift and making sure that workers have access to the training and upskilling so that they can help participate in the telemedicine. And that's true across the service and care workforce. And those workers and their families are also the ones stuck in the digital divide, where they may not be able to access the training and upgrading that's already occurring online. So I just think it's another way to solve a problem and to help escalate the innovation that I think has just been amazing to witness in the healthcare sector.
Perfect. Julie, anything to add?
I was just going to say that COVID has given us a proof of concept here that, as Jim mentioned, we sort of can't ignore and sort of, or I guess everyone, Mary Kay, the Congresswoman, that we can't go back from. And so I think it really is taking the lessons learned, figuring out how do we address some of the other disparities, as was mentioned, around rural broadband. That is definitely a part of our infrastructure agenda and the plans that Biden has put forward. But I do think it's a tremendous opportunity, and especially when you see the opportunities in mental health care services that I know are tremendously lacking within the country and other forms of healthcare services. It's a real opportunity that we have before us that we should definitely build upon.
So we've got time for two more topics, which I'd like to cover. The one is prescription drugs, and I'd like to end by focusing on being prepared for the future, like Congressman you mentioned when we started. Jim, you talked about the Civica RX. Are you seeing the kind of results that show that this is scalable? And are there any policy proposals that you think we should also be considering?
Yeah, the truth of the matter, Jim, is this is an early concept. And I appreciated Julie's comment earlier about proof of concept. COVID has proven a few things, telemedicine being one, but our movement to get into Civica RX with the other systems, that is still to be proven. Frankly, we like the idea of controlling our own future. Way too dependent. One of the lessons learned, way too dependent on supply chains, of others. And so the idea of never being caught off guard, not having enough PPE, that's just something we didn't want to risk. So we'll still need supply chain partners without a doubt, but having that ability, and this is largely a company that will perform, N95 masks and gowns and those kinds of things, absolutely crucial. But being in control of our own destiny just a little bit more, we think is wise. It's a domestic, it's based here in the States. It's not overseas. We like that. It's minority-owned business. We like that. There's all kinds of good things about it. So we're excited about Civica RX, but the truth of the matter is, Jim, we do not yet have, all the proof that we would like to come back and demonstrate. We're confident we're going to get it. It's just a matter of time.
So, Congressman, what is your take on what we should do in Congress?
Well, when we look at prescription drug costs, we passed legislation in the House, the Elijah E. Cummings Lower Drug Costs Now Act, very, very important because this issue, I think every single member of Congress has heard from their constituents, just the huge increases they've seen in prescription drug costs. The one example I usually use is insulin, where there hasn't been new innovation or change, basically the same drug, but the cost has gone up hundreds of % over time and become unaffordable, where we have patients who've tried to figure out how to stretch their insulin out over a longer period of time, which has been deadly for some patients. There's no reason we should be in this situation. So the important piece of the legislation we passed is to make sure the most expensive and widely used drugs, that there is negotiation, that we make sure so that patients have access and those costs are kept in line. And that there has to be more attention given to this issue. We passed pieces of this legislation in the Patient Protection and Affordable Care Enhancement Act. There's no reason that Americans across the country, where we have so much incredible innovation, it doesn't help if we innovate and create new drugs if they're not available. The public can actually afford to use them. So we have a lot of work to do here. We pushed this forward and made this a top priority in the House. But again, we need a Senate and a White House who is willing to help tackle this issue with us so that we can really make a difference for the American people.
We've only got a little bit of time left. Mary Kay or Julie, anything to add on prescription drugs?
We want to bring the cost down, and people need better access. And I think the two ideas that we just heard, working people, their families and communities are crying out for. And as a nation, it's time to get it done.
So Mary Kay, the biggest thing I wrote down on all my notes today is the 3 million healthcare jobs. Let's start off there. As we think about being more prepared, as Congresswoman Delveni mentioned at the start, and as Julie's talked about, what are the things we should be doing, not just to get through this one, but to prepare for the next one?
I think that it's really critical to make sure that we elect national leadership that are going to work with the business community, with working people and communities of color to address the long-standing disparity and to the crisis that's been created by the pandemic. And so I really look forward in more roundtable discussions like this, Jim, to put our shoulders to the wheel and get it done together as a nation.
And Julie?
Well, I would just, echo that and also just say it's so exciting to be able to be with folks who understand, just a holistic approach that our communities need right now. What COVID has exposed is disparities that have existed for far too long, and that we need a much more intentional approach. I think, Jim, you mentioned the social determinants of health and an opportunity as a country to be able to look at that holistically and be able to move forward some of the really critical components in healthcare that we talked about today, but also tackle education and employment and so many of the other systemic issues that are facing our nation right now. So thank you all so much for your time, commitment, and real vision for our future.
And Jim, what if our hospitals learn in this pandemic that they can apply to the next one?
Oh, I think the comment about preparation, I think that your nation's hospitals have been through the ringer, so to speak, and as a result, are much better prepared the next time around. I think you're going to see organizations re-examine what was oftentimes touted as just-in-time inventory because it keeps the cost down. But when you find yourself with just-in-time inventory and then you need a huge influx of it and it's not available, you find yourself wanting. Now, the good thing is Advocate Aurora Health, we never found ourselves in that situation, and kudos to our supply chain leadership that scoured the globe, to meet the needs to protect our team members, which we've done great. But I know we're out of time, Jim. The only thing I'd want to add, if I could, is, and there's been so much good, healthy discussion amongst this panel about health disparities and racial inequities and so on. I mean, I think that COVID has demonstrated that we are not fighting one but two pandemics, right? One which hit us in February of this year, and one which has literally been with us since the birth of our nation, right? and it's really kind of come to a forefront. And when good-minded, well-intentioned people like these panelists can come together, I do believe that solutions are possible. We might differ a little bit on how to get it done, but I don't think we differ on what we want to accomplish for the good of the, in this case, for the patients that we're so very privileged to serve. So, thanks for having me today.
Any other closing comments?
I just wanted to add that folks talked about the supply chain issues and how important those are. We had supply chain issues before the pandemic. We even had healthcare providers struggling with access to sterile saline. So we have work to do to address supply chains for crisis, but also just the day-to-day supply chain challenges that we've had across the country, and make sure that we are set up for resiliency. And the last thing I'd like to say is it will be so important. I started my career doing biomedical immunology research. So as a scientist and someone who thinks that we can, that data helps us understand and figure out the best solutions to problems, to really make sure that we are investing in that science and research and respecting that information to help us come up with answers. Unfortunately, something the current administration has undermined, that is going to be critically important to the future as we look at not only responding to a crisis or preparing for a future crisis, but also addressing important issues like the systemic disparities that we've seen in healthcare. There's work that we can do, and we can solve these issues. We've got to respect the healthcare professionals, the science, and all the information that collected to make sure we give the best response possible.
Thank you. Just a final note for those of you watching, if you need any more reason to think that this is an important topic, Kaiser Family Foundation estimates that as many as 27 million Americans could lose their employer-sponsored insurance over the next several months because of COVID layoffs. It hasn't affected as many people yet, but it could in January and February. 8 out of 10 of them would qualify for either Medicaid or an ACA marketplace subsidy. We should be making it easier for them to enroll and to switch. And unfortunately, the Trump administration is working very hard to make it harder. They've refused to extend enrollment windows. They've cut funding for marketing by 90%. They've cut funding for assistants, counselors to help people enroll by 83%. There are entire counties that don't have a human person that someone can go visit to enroll. So this is important today, but it's going to get more important over the next several months. And we appreciate you joining us. To the panelists, thank you very much. We really appreciate your time, and we look forward to working with you. Have a great day.
Thank you.
Thank you.
Thank you very much.